Hello and welcome. Today we'll be exploring a complex group of diseases known as vasculitides, with a particular focus on their impact on the nervous system. Vasculitides, at their core, involve inflammation of the blood vessels. When these inflamed vessels supply the brain, spinal cord, or peripheral nerves, the consequences can be severe, leading to a wide range of neurological complications. Join us as we delve into the causes, mechanisms, symptoms, diagnosis, treatment, and the latest research surrounding these conditions. So, what exactly causes these blood vessels to become inflamed? The etiology of vasculitides affecting the nervous system is often multifaceted, and in many cases, not entirely understood. Autoimmune disorders are frequently implicated, where the body's immune system mistakenly attacks its own blood vessels. Infections, certain medications, and even genetic predispositions can also play a role in triggering these inflammatory responses. In some instances, the cause remains unknown, classified as idiopathic vasculitis. Identifying the specific trigger is crucial for effective treatment and management. To understand the effects of vasculitides, we need to look at the underlying pathophysiology. The inflammation weakens the blood vessel walls, leading to narrowing, blockage, or even rupture. This, in turn, reduces or completely cuts off blood flow to the nervous system structures supplied by those vessels. The resulting ischemia, or lack of oxygen, causes damage to nerve cells, leading to a variety of neurological deficits depending on the location and extent of the affected vessels. The inflammatory process itself can also directly damage the nerves. Furthermore, the inflammation can cause the blood vessels to form aneurysms, which are bulges in the vessel wall that can rupture and cause bleeding in the brain or spinal cord. When we talk about the frequency of vasculitides affecting the nervous system, the term we use is epidemiology. These conditions are generally considered rare, but precise numbers are difficult to ascertain due to the challenges in diagnosis and classification. Some types of vasculitis, like giant cell arteritis, are more common in older adults, while others, such as Kawasaki disease, primarily affect children. Certain geographical locations and ethnicities may also have a higher prevalence of specific types of vasculitis. Understanding the epidemiological trends helps researchers and clinicians identify at-risk populations and develop targeted prevention and treatment strategies. The signs and symptoms of vasculitides affecting the nervous system are incredibly varied, reflecting the diverse ways in which these conditions can impact the brain, spinal cord, and peripheral nerves. Headaches, often severe and persistent, are common. Other symptoms may include seizures, stroke-like events, cognitive dysfunction, and changes in vision. Peripheral neuropathy, characterized by numbness, tingling, and pain in the hands and feet, can also occur. Muscle weakness, fatigue, and skin rashes may be present as well. The constellation of symptoms depends on which blood vessels are affected and the severity of the inflammation. A high index of suspicion is necessary to consider vasculitis as a potential cause of neurological symptoms, especially when accompanied by systemic signs like fever or weight loss. Diagnosing vasculitides involving the nervous system requires a comprehensive approach. It begins with a detailed medical history and thorough neurological examination. Blood tests are essential to look for markers of inflammation, such as elevated erythrocyte sedimentation rate as ESR and C-reactive protein as CRP. Imaging studies, including MRI and CT scans of the brain and spinal cord, are used to visualize any abnormalities, such as areas of inflammation or stroke. Angiography, a technique that visualizes blood vessels using contrast dye, can help identify narrowed or blocked arteries. However, the gold standard for diagnosis is often a biopsy of an affected blood vessel. This allows pathologists to examine the vessel wall under a microscope and confirm the presence of inflammation. Vasculitides are not a single disease entity but rather a group of distinct conditions, each with its own characteristics and diagnostic criteria. Some of the major types include giant cell arteritis, which predominantly affects the arteries of the head and neck, Takayuso arteritis, which involves the aorta and its major branches, polyarteritis nodosa, affecting medium-sized arteries, granulomatosis with polyangiitis, formerly known as Wegener's granulomatosis, often affecting the upper respiratory tract, lungs, and kidneys, eosinophilic granulomatosis with polyangiitis, formerly Churg-Strauss syndrome, associated with asthma and allergies, and microscopic polyangiitis, affecting small blood vessels. Central nervous system vasculitis, or CNS vasculitis, is a broad term encompassing vasculitis primarily affecting the brain and spinal cord vessels. Distinguishing between these different types is critical for guiding treatment strategies. Treatment for vasculitides affecting the nervous system aims to suppress inflammation, prevent further damage to the blood vessels, and manage any associated complications. High-dose corticosteroids, such as prednisone, are often the first-line treatment to rapidly reduce inflammation. Immunosuppressant drugs, such as cyclophosphamide, methotrexate, or azathioprine, may be added to help maintain remission and reduce the need for high doses of steroids long-term. Biologic therapies, such as rituximab, which targets B cells, are also increasingly used in certain types of vasculitis. Other supportive treatments may be needed to manage specific symptoms, such as pain relief for neuropathy or anti-seizure medications. Physical therapy and occupational therapy can help improve function and quality of life. The choice of treatment depends on the specific type of vasculitis, the severity of the disease, and the patient's overall health. Unfortunately, because the exact causes of many vasculitides are not well defined, primary prevention strategies are limited. However, managing underlying risk factors, such as autoimmune disorders or infections, may help reduce the risk in some cases. Avoiding unnecessary exposure to medications known to trigger vasculitis is also important. Early diagnosis and prompt treatment are crucial to prevent long-term complications and improve outcomes. The prognosis for vasculitides affecting the nervous system varies widely depending on the specific type of vasculitis, the severity of the disease, the promptness of diagnosis and treatment, and the presence of any associated complications. With aggressive treatment, many patients can achieve remission and live relatively normal lives. However, some patients may experience relapses or develop chronic neurological deficits. Researchers are actively investigating new therapeutic targets and developing more effective and less toxic treatments for vasculitides. Advances in imaging techniques are also improving our ability to diagnose vasculitis earlier and monitor treatment response. Ongoing research holds promise for improving the long-term outcomes and quality of life for individuals affected by these challenging conditions.